as John say, we always like to learn the new language. Okay, ladies and gentlemen, the chairpersons, this is my honor to stand here to talk about the role of perampanel as an early add-on treatment in patients with epilepsy. So this is my disclaimer, and I would like to share some cases of my experience in adding on the perampanel in treatment of epilepsy patients. The case one is a 27-year-old female, has a moderately mental retarded. She has epilepsy since 3.5 years old after head injury. And her seizure patterns are general tonic-clonic seizures preceded by aura. That is a focal non-motor onset seizure evolved into bilateral tonic-clonic seizures from the latest seizure classification published in 2017. And her EEG shows multifocal spikes, and the MRI was unremarkable. We have given her corpus gallosotomy anterior two thirds at the age of 9 years old because of intractable seizures. And there is only a partial improvement. And her seizure frequency before I use Vicompa, that is perampanel, I'm going to talk today. The seizure frequency is 1 to 4 general tonic-clonic seizures per month, and quite ineffective to many medications, including phenytoin, carbamazepine, vaporized levetiracetam, topiramate, vigabatrin, and clobazam. And her current anti-seizure medications was vaporized combined with perampanel, 8 milligram per day. She became seizure-free after I gave her perampanel 8 milligram since the year 2017, April till now. And this is the case number 2. 27 years old female, also mentally retarded, and a case of Lennox-Gastaut syndrome since the age of 7 years old. She had meningitis at the age of 1 year. Her seizure patterns are multiple types, including atypical absences, autonomous motor seizures, general tonic seizures, and general tonic-clonic seizures. And her EEG shows typical pattern for the Lennox-Gastaut syndrome, including generalized slow spine wave complexes, polyspice, paroxysmal generalized fast activity, and of course, diffuse background slow. Her MRI showed the right mesial temporal sclerosis, but I don't think it has any relationship with the Lennox-Gastaut syndrome, maybe some part. Yeah. We also gave her corpus gallosotomy anterior two thirds at the time we did, but now we did complete gallosotomies for all patients. But at that time, we only performed anterior two thirds gallosotomy. And the patient had only partial improvement after the operation. And her seizure frequency before I used Vicompa is 1 to 4 general tonic-clonic seizures per month. Her seizures is also quite effective towards phenytoin, carbamazepine, vaporized levetiracetam, topiramate, vigabatrin, lamotrigine, pregabalin. Almost all anti-epileptic drugs I can use in Taiwan with the highest tolerable doses. And her current anti-seizure medications are vaporized with perampanel, also 8 milligrams per day. She was seizure-free after I gave her perampanel 8 milligram since the year 2016, July. So this is the outline today. I will quickly let you know what is perampanel and how it helps people with epilepsy. And I'll just briefly through the perampanel profile. And most importantly, I will update the real-world results in the early add-on therapy and the use in elderly patients. And I will show you some personal experiences in adding on perampanel. As you know, as Professor John done yesterday in his slides, there's anti-seizure medication categorized chronologically and can be divided into 3 generations. The first generation anti-seizure, anti-epileptic drugs, including bromide, which we are not using today, maybe used in dogs in treatment in the animals. But still, there are some first generation medications we are still using today, phenobarbital, phenytoin, and carbamazepine, and valproic acid. as Professor John told us yesterday, actually this medication is just as good as new medications. Or we can say that the newly developed anti-seizure medications are no better than these old anti-seizure medications. Okay, and the second generation anti-seizure anti-epileptic drugs are invented mostly in the 1990s, including zonisamide, vigabatrin, lamotrigine, oxcarbazepine, and gabapentin, etc. And in recent years, there comes the third generation of anti-seizure medications, including rufinamide, lacosamide, and the eslicarbazepine, and also perampanel, etc. Perampanel is the topic I'm going to focus on today. Please remember this year, European Medical Association and the American FDA approved the perampanel in the year of 2012. And the indication for perampanel is for the focus on the focal onset seizure, whether they have evolved into bilateral tonic-clonic seizures or not. And also for the primary generalized tonic-clonic seizures. These are the two indications for perampanel in most of the countries in the world. And anti-seizure medications, when we talk about this, we must talk about the mechanism of actions. Yeah. Well, the first mechanism for the anti-seizure medications is to decrease to inactivate the presynaptic excitability, which involve the sodium channel blocker and potassium channel and calcium channel, and even block the synaptic vesicle 2A release. The second group is to enhance the activity of GABA inhibitory system via some medications through the GABA action. And the third group is the presynaptic. We try to inactivate to decrease the presynaptic excitability. This is Fycompa acting at. Fycompa is acting at the glutamate receptor, one of the glutamate receptor called AMPA receptor. Perampanel is the non-competitive blocker of the AMPA receptor. So just go quickly through some dosage administration and pharmacokinetics. Fycompa can be used once daily in the bedtime, so it is very easily to be used. The starting dose should be 2 milligrams per day. And the dosage for the focal onset seizures usually 4 to 12 milligrams, it will be effective, the dose. And if you want to use in the primary tonic-clonic seizure, the dosage may be somewhat higher, between 8 to 12 milligrams. They will show the most effectiveness. And in some patients, especially they are taking cytochrome P450 inducing agents, you might slightly a little bit increase the dose of Fycompa when you are using. The daily maximum dosage for Fycompa is for the perampanel is 12 milligrams. And perampanel has a very long half-life, up to 100 hours. And it has very high percentage of protein binding, and the metabolism is mainly through the cytochrome P450. Please remember, if your patient has moderate or severe renal or hepatic impairment, you should not use perampanel in such kind of patients. Always remember, when you use the medication, start low, go slow, you can decrease a lot of side effects. This, I think, is except the case of status epilepticus, because this principle can be applied in all the anti-epileptic drugs uses. And also, please remember what is the daily defined doses. This is defined by the WHO. It is defined as, the definition is that presumed maintenance daily doses for an adult. The defined daily doses for perampanel is 8 milligrams. Its meaning is that if the patient did not achieve the seizure free, you should not give up until the doses reach 8 milligrams per day. unless the patient has intolerable side effects or others. So this is a very important PowerPoint that I believe all of you are quite familiar with. It is published by Brody and Professor Kwan, and it is about the treatment success in newly diagnosed epilepsy. On the left side is the data published in the year 2000. We can see the purple one. The purple one is after the after maybe 3 or more anti-epileptic drugs used, the patient still has medically refractory seizures. That is what we call drug-resistant epilepsies. The percentage is 35.5% in the year of 2000. However, till the year 2012, the refractiveness, the drug-resistant epilepsy, the percentage still 33.5. It looks like no much difference between two. What happened? During these 10 years, a lot of new second generation anti-seizure medications has been invented and been used, but the percentage of the drug refractory epilepsies seems about the same. No much improvement. But please remember that perampanel was approved by the European Medical Association and America FDA in 2012. So at that time, perampanel was not included. As Professor Brody suggested, when you are going to start a polytherapy in treatment of refractory epilepsies, you should follow the following guidelines. The first step is that you should establish an optimal dose of the baseline agent. And the second, when you add new anti-seizure medication, you should choose multiple mechanisms and avoid combining similar modes of actions. And through these different three different groups of mechanism of action for the anti-seizure medications. So we should choose different modes of actions, anti-seizure medications in combination when you are going to do the polytherapy. Just like every country has Army and Navy and Air Force. You don't need to have 2 Army, you don't need to have 2 Navy, you don't need to have 2 Air Forces. This was published by Stanhope in 2013, 10 years ago. It is an early study on the perampanel on therapy. From this study, we can see even the patient already on carbamazepine, vaporizine, and the lamotrigine and the levetiracetam. After adding the perampanel, you can see there is a significant significant percentage of seizure reduction. And comes back to recent years. This paper was published 3 years ago. It is real-world data from the FAM study about the first add-on Fycompa for local onset seizures. Let's see the results. And this study includes 80 patients. Oh, the circle already there. I don't know why. Okay, for focal onset seizures, you can see after the add-on Fycompa therapy, you can get a 47% seizure freedom rate. And for the secondary generalized, for the SG means secondary generalized seizures, you can have even up to 75% of seizure freedom rate. And this paper published 1 year later in 2021, also the real-world data from the comparison perampanel study about the first add-on versus late add-on effect of Fycompa. This study including 81 patients, and the median dosage of perampanel is about 6 milligrams per day. And you can see there is great differences between early add-on and the late add-on, from not only from the retention rate. The pink color is the as the early add-on, first add-on, and the blue color bar is late add-on. you can see great differences between first aeon and late aeon, responder rate and seizure freedom rate. Let's focus at the seizure freedom rate. In the first aeon group, you can achieve even 71.4% seizure freedom rate in the early aeon group. It's magic, you know. So in other studies from 2018 to 2020, there are many studies focused on the early aeon therapy for the Fycompa. Let's look at this. What's the results? The average doses were about 6 milligram per day, and the effect for the focal seizure, focal to bilateral tonic-clonic, and generalized tonic-clonic, the seizure freedom rate in all these studies is from 26 to 84%. It is high. And how about the safety profiles in these studies? The most common side effects include somnolence and irritability and dizziness, but there are great differences in the percentage. Some as low as 1.8, some reported as high as up to 50%. But according to them, most of them, the side effects are tolerable. And this is the latest paper published just a year about the early aeon and versus late aeon therapy for the effect of perampanel treatment. This is the evidence from the PERMIT study. They divided into two groups. The first group is early aeon perampanel group. That means that the patient had only used 1 to 2 anti-seizure medications before. The number of this group is up to 1,100. And the second group is late aeon perampanel group. That means that the patient has been used 3 to 19 anti-seizure medications before. The number of this group is up to 2,800 patients. This is a huge number group. And we can, what is the result? And from the results, the focal seizures, in the focal seizures, this group, in the first aeon, you can achieve 29% seizure freedom. And in the GTCS seizure group, if you add on the perampanel as the first or the second aeon medication, you will achieve about 69% seizure freedom. So also you can see there is great differences between the seizure freedom rate of the both group between early aeon and late aeon. So it tells us, all these papers tells us that the patients will have better effect of treatment if you early aeon the perampanel for them. So how about the perampanel using elderly patients? This paper has included 92 patients from the mean age is 69 years old. The median dosage of perampanel is 6 milligram per day. You can see there is up to 23.9% patients can get seizure free. And the side effect still irritability, somnolence, and dizziness, but most of them are tolerable. And there is no much side effect on the cognitive function. And how about perampanel used in Asian people with epilepsy? There is an opinion, expert opinion published last year. The experts are included from China, India, Indonesia, Japan, Philippines, Taiwan, and Thailand. These epilepsy experts had reviewed 2 clinical trials and 7 real-world studies, and they come into the conclusion is that perampanel is an appropriate anti-seizure medication in patients with cardiac comorbidities. And perampanel does not decrease the plasma concentration of commonly used cardiovascular drugs. And perampanel has a low potential for drug-drug interaction of clinical significance. And it is generally well tolerated to treat these senior patients with epilepsy, and especially in vascular etiology. Interestingly, is Japan, a study in Japan, retrospective study for patients with Alzheimer's disease and elderly onset epilepsy, they found the cognitive function showed improvement in about 58% after 6 months treatment of perampanel. It's again a magic, very good. So comes back to the cognitive function, the impact from perampanel. Is there any side effect? Okay, this study included 241 patients. About 46% are pediatric patients. Their conclusion is that the effect of the perampanel on cognitive function, it is neutral. It shows no systemic cognitive deteriorations or improvements. So the answer is no, that is at present, but I don't know whether it is true in the future. But however, there is no significant impact on the cognitive function. So what are the current understood effects of anti-seizure medications on sleep? In this paper, lots of medications were reviewed. Let's just look at the perampanel. Perampanel can decrease the wakefulness after sleep onset and can increase the slow sleep stage 3 and can improve insomnia, and it is reported can improve restless leg syndrome. So in this study, including 25 patients with perampanel median dose 60 milligrams, it shows that the conclusion is that perampanel can improve sleep parameters, including total sleep time, the sleep latency, sleep efficiency, sleep maintenance index, wake time after sleep onset, and the duration of stage 3. And perampanel can improve all the sleep architectures. So this is the last 2 slides. My personal experience. I have done this a very rough estimation many years ago when I started to use Fycompa perampanel in Taiwan. I have followed up these patients for only 1 year. They are total 35 patients, and the mean age, average age is about 35 years old. And most of them, all of them are drug-resistant epilepsies. Most of them are focal seizures. Anti-seizure medications has been tried before perampanel use. The number is 6. You can see I use almost all the available anti-seizure medications for these patients, but still ineffective. And the seizure-free, and then I get the seizure-free in 8.5%. You may say it is very low, nothing to be proud. But please remember, in the Patrick Kwan and Brody's published data in 2012, the seizure-free rate after you use 2 medications, it is only 3.7%. Now, I add on perampanel for all these patients. I still get the seizure-free rate is 8.5%. That is almost 3 times higher. Almost 3 times higher. Okay, please remember that. And the question is that I add these medications from the definition is late add-on. But what if I already add on perampanel on these patients? Maybe I will have double the seizure-free rate. I hope so. And of course, some of my patients is suffering from side effects such as aggression, hostility, fall, and the poor balance, suicide ideas, and severe dizziness, drowsiness, increases seizures also. And some of them needs taper or start the medication or perampanel. So the last slide I want to tell you, actually, we are very concerning about the side effects of a psychiatric aspect from the perampanel. But I must tell you the truth. Actually, all anti-seizure medications has psychiatric side effects, including anxiety, nervousness, psychosis, or aggression, hostility. You cannot find any drug, any anti-seizure medication without such kind of side effects. But this means that we should put a lot of attention when we use anti-seizure medications in treating epilepsy. So thanks for your attention. Final words is perampanel, an effective weapon to fight the drug-resistant epilepsy. If you early use, you can prevent a lot of injuries, such as in the photo I show you. Thank you very much. Thank you.